The Ryan Shazier injury. What happened? How did it happen? How was it diagnosed? And what happens next? Stay tuned to find out. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel, your favorite source for information on broken bones and other things.
That's a little doctor joke we like to make around here.
So today, after many requests from several of you to do this injury, I am now finally getting to it. So today we're talking about the Ryan Shazier injury. And although this is not a current injury, I thought that I would review this so that I could give you my insight and let you know a little bit about what I think has happened and what is going on currently. So as many of you know, Ryan Shazier is an inside linebacker for the Pittsburgh Steelers. He was injured on December 4th of 2017 in a game versus the Cincinnati Bengals. Question number one, what happened? Ryan was injured on a play while he was tackling a receiver. Ryan made the tackle when his neck was flexed and his head was down. Immediately after making the hit, he suffered flaccid paralysis of his lower extremities. He was carted off the field, immobilized on a stretcher. Initially, he was said not to require surgical intervention. However, 2 days later, he underwent a spinal stabilization procedure. He spent a period of time in the hospital before being discharged, and since that time, he has been undergoing extensive rehabilitation. Over time, he has continued to make progress, and he is working towards his eventual goal of returning to the field as an inside linebacker for the Steelers. And he has worked towards this goal even though he was initially advised that there would be only a 20% chance that he would walk again. Initially, at the time of injury, after the preliminary examination, Ryan was diagnosed with a spinal contusion. But Michael Steele's ESPN subsequently reported that the bones around his spinal cord were dislocated and that spinal stabilization would be required. So although this was not reported, the requirement for spinal stabilization implies that there was either a dislocation or a fracture or a significant ligamentous injury present that was causing the instability of his spine. A spinal contusion is an injury that is caused by crushing of the spinal cord at a particular level, with preservation of the nerve fibers above and below the level of the injury. The severity of the injury is determined by the status of the remaining nerve fibers and their ability to transfer action potentials, or in other words, their ability to transfer nerve signals across the zone of injury. When spinal contusions occur, there are both primary and secondary injuries. Primary injuries occur from the actual injury mechanism itself. This is caused by both the crushing force and the associated bleeding at the site of injury. The reactive chemicals that are released at the site of injury cause tissue destruction, and this is what leads to the secondary injury. But as I mentioned before, since a spinal stabilization procedure was required, we know that there was also an injury to either the ligaments or the bones of the spinal column. And at some point, his treating physicians felt that the stability of the spine had been compromised, requiring a stabilization procedure to make sure that the spine remained stable. Stability of the spine has been described using the three-column model of Denis. Denis separates the spinal column and its parts into three distinct columns, the anterior, middle, and posterior column. If the structural stability of any one of these columns is lost, then the overall stability of the spine has been compromised, and therefore the spine will require stabilization. So at some point in Ryan, at least one of these columns was compromised, and his surgeons elected to proceed with a stabilization procedure. So now that we know what happened, how exactly did this happen? So if we look to the slow motion replay, we see that immediately before the tackle, Ryan dropped his head and he struck his opponent's hip with the crown of his head. We can see that initially he suffered an axial load, meaning a load applied to the top of his head, and then this was immediately followed by an extension of his cervical spine as he fell to the ground. And this initial mechanism might imply that he suffered an injury at the cervical level, or in other words, in the area of his neck. However, we see that he was able to move his upper extremities without difficulty, and he immediately suffered paralysis of his lower extremities. So this suggests that the injury occurred at either the thoracic or the lumbar level, meaning at the level of the chest or down below. And although we know that he suffered some kind of spinal cord injury as a result of this paralysis, It is difficult without further examination and imaging to know whether this was a fracture, a dislocation, or just some kind of spinal contusion at that time. So this leads us to question number 3. How was his injury diagnosed? After being taken off the field, Ryan's medical staff would have performed a physical examination. And in the physical examination, the medical staff will be looking for signs and symptoms of spinal cord injury. These signs and symptoms would include paralysis, loss of motor function, loss of sensory function, abnormal reflexes, abnormal rectal tone, tenderness at the site of injury, and CREPITUS and/or palpable deformity at the site of injury. Upon arrival at the hospital, the physical exam would be repeated by the attending physician. After the physical exam was complete, then they would perform X-ray examination of the spine and the extremities in order to assess gross alignment and overall structure. And here they would be looking for any obvious fractures or dislocations of the spinal segments. If they noted damage on X-ray and they required further information, or if they noted damage that was quite subtle and they required further clarification, then they would go on to perform a CT scan, or computed tomography scan. A CT scan is a machine that allows us to take a large number of X-rays in various planes and positions over a very short period of time. The CT scan would allow us to assess very subtle fractures, and it would also allow us to assess the 3 columns for stability. An MRI scan, or magnetic resonance imaging scan, would allow us to look at all of the soft tissues around the site of injury, including ligaments and/or the intervertebral discs. And an MRI is a machine that allows us to use magnetic waves rather than radiation to image structures within the body. So in Ryan's case, it's likely that both the CT scan and the MRI scan showed subtle injuries and instability of the spine, making spinal stabilization necessary in order to preserve the overall stability of his spine. So as was reported, Ryan Shazier underwent a spinal stabilization procedure. It has not been reported at what level this procedure was performed, so it's very difficult for me to comment and say exactly where and what was done. However, given the initial level of his flaccid paralysis, we can guess that it occurred at either the thoracic or the lumbar spine levels. Typically in these cases, a posterior stabilization is performed, and this just basically means that they approach the spine through an incision in the back. During the procedure, they put pedicle screws into each of the vertebrae involved in the injury, and then they connect these screws to one another with rods and interlinking bars in order to stabilize the segment that has been injured. Typically, they'll put bone graft in between each of the vertebral bodies that has been involved in order that these vertebral bodies may be fused into a single unit. If there is significant compression of the spinal cord, then this procedure may also involve a decompression or a removal of the lamina of the involved vertebrae in order to provide more space for the spinal cord itself. Fusion of the spinal column will be followed by 8 to 12 weeks of immobilization in a TLSO, or thoracolumbar sacral orthosis brace, in order to maintain stability of the spine while the fusion is healing. This will then be followed by extensive physical therapy in order to restore lower extremity function. So this leads us to our final question. What happens next? Well, at this point, physical therapy and rehabilitation are ongoing for Ryan Shazier. Ryan continually shares posts on both Twitter and Instagram to show us how his rehabilitation is going, as he is extremely determined to make it back to the NFL. He shared posts of himself dancing at his wedding and posts of him doing box jumps while he was training on his Instagram, so we can see that he is determined to make it back to the field. And I don't know if this is going to be a possibility, but only time will tell. If all things work out, hopefully Ryan Shazier will be able to make it back to the NFL to play football, the sport that he loves so much, once again in the future. So there you have it. Today we've been looking at Ryan Shazier's injury. Be sure to like, share, and subscribe. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.